purpose, like she said, is a snack and learn. You only have a short amount of time on the unit to take a few minutes to learn, and with the summer coming and the new glucometers coming, I think it's a great opportunity we can share with some of the staff nurses a little bit, not only about how to clear the glucometers and get a blood sugar, but also facts about diabetes. And I'm gonna talk about some highlights from the 2019 ADA, American Diabetes Association, standards of care to enhance the professional practice and increase the staff nurse's confidence at the bedside. And that ultimately is gonna lead to increased awareness and safety and quality patient care. And it all goes back to why we do what we do, and this is my grandpa who has diabetes, so as we're caring for our patients, we're thinking this is somebody's grandfather, it could be ourselves actually as the patient, or somebody's sister, even a family member, so we're going to increase the quality and safety of their care. Learning outcomes, just to kind of run through these, discuss glycemic control and current diabetes technology, identify recommended pharmacological therapy for treatment of diabetes, so we'll talk about some of the medications, acknowledge attributes of effective patient-centered discharge teaching. So it's impossible to cover the entire standards of care. That would take probably a couple of weeks, but we're just gonna go through really quick some just highlights I thought were interesting. So we'll start with glycemic control goals, and ultimately we want to keep them patient-centered. Not every patient, it can't be cookie cutter. Everybody is not going to need or desire the same care. Just like I pointed out, my grandpa, he wants to have Chinese food every month. So that's his goal. And whereas the single mother working full time and trying to take care of her 3 kids, her goal may be just to provide and try to get dinner ready for them and not go through fast food as much. And maybe we can help her learn how to cook some quick meals and healthy meals at home. Collaborative process, it's their support system, the patient, their loved ones, friends, the doctors, the dietitians, nutritionists, point of care testing. If we can get testing done quickly, and we're going to talk more about the tests that we do at the bedside, or the quicker we can get the testing done versus having to wait on lab results, then you can go ahead and manage their care and start their treatment more timely. So the A1C test is the primary test used to maintain and to reach their glycemic targets. You're going to want to do the A1C test. A reasonable goal for most patients, and this is for non-pregnant patients, adults, less than 7%. But you may be able to do a less stringent goal for, say, that 80-year-old who may be at risk for hypoglycemia more so than someone that's just been diagnosed with diabetes, and they may have a more stringent, like a 6.5% goal that you could do. So it's not, that goal is reasonable for most people, but everybody is individual. At least twice a year, you're going to want to do the A1C testing if it's controlled and stable. Quarterly, more often if there has to be a treatment change done, or if they're not meeting their goals, which is usually when they have to do a treatment change. Just briefly about diabetes technology. This was the first year that the ADA included a section specifically for diabetes technology in standards of care. There's actually an entire section on it, but it defines diabetes technology, and basically it's anything that diabetics can use, like computers, software, devices, to prevent complications and improve their quality of life. Pens, syringes, pumps, glucose meters like we're getting, that's diabetes technology. Hybrid devices are an example of diabetes technology that not only monitors glucose, but they can deliver insulin, so they can provide, monitor, and deliver insulin. Patch type disposable devices, they can be worn and give a continuous rapid insulin, and they can also, the patient can press a button and it deliver a couple more units of insulin for them, and then it can be disposed of. And then the smart pens, they can program their insulin dose, and it also can be set up to provide downloadable data. There's a whole lot out there. So now we're going to transition to more interactive, and we're going to draw medication facts from this bucket while we're listening to some music and throwing around the beach ball. So you're going to get to move. It's fast-paced now. So when the music stops and you have the ball, you're going to be the one to pull the one fact out, which is on a smiley face, and just read the fact. Who wants to start it out? And the song is "This Is Me" from the Greatest Showman soundtrack. And so, I don't know if anybody's ever seen it. So the characters, the actors, and their performers, or what they're called, they had to embrace that they were different. And so with diabetes, a lot of these patients are having to embrace a new life and having to do things a bit different. So,
y'all ready?
Tracy wants to start.
Okay.
Try not to knock your... Get a little exercise. Kathy had it.
Kathy had it.
Kathy had it. You just have to just read it. Just read the fact. This is just sharing facts about medication.
So, metformin is recommended as the first-line pharmacological therapy for type 2 diabetes.
Thank you.
All right.
That's your fact. Oh, somebody get called. That was like a big group. We got a few of these to go now. We got enough for everybody.
All right. Metformin reduces the risk of cardiovascular complications. Yes. Okay.
Nobody get hurt. It's not too hard. You just have
I have two here.
Okay.
they stick together. They're
Yes.
smiley faces.
Sulfonylureas are associated with an increased risk for hypoglycemia due to their action of stimulating pancreatic insulin release. That's true. Yes.
They're all true.
Oh.
They're all true.
I was feeling really smart.
Some of these words you didn't say, you did great.
Yes. Can you spell it? All right, so there.
What he's doing? Sorry.
More or less.
Oh, gosh. Leave it to Kathy.
You can't catch.
Leave it to Kathy.
Did you do it again?
You're on draw.
We'll make Kathy do it.
Draw.
We're gonna do it, Kathy.
Okay. Glucagon-like peptides, GLP-1 receptor agonists such as Trulicity and Victoza promote the release of insulin by stimulating GLP-1 receptors in the intestinal mucosa. These drugs are administered twice a day by subcutaneous injection. The extended release injections are administered once a week.
There was a lot of information now. Good
That's
job.
true.
Good job. There's a lot of condensing in there. We got a few left.
Oh, now we're handing it. Everybody's trying to be safe.
It was in the air. It was in the air.
Kills it.
You don't have to answer any questions. Just read.
Metformin is not associated with weight gain and has few adverse effects.
Good.
I'm not going across for it. Okay, yes I am.
I'll be
Metformin is the least expensive drug for diabetes type 2 treatment.
Do it. That's it.
I can do this one. Metformin may interfere with vitamin B12 absorption, thus B12 levels should be monitored.
Who wants the last one? Thank you.
Second generation sulfonylureas
Good job.
are preferred as second line adjunctive, I guess that's how you say it, treatment for type 2 diabetes. Examples are Amaryl, Glips,
Good job.
I got a hard one.
You're doing good.
Stimulate pancreatic insulin release and enhance insulin sensitivity.
Good job. Thank you. So you learned something about some medications. A lot about metformin. So there's a lot out there. And back up here, look at this. Can you figure out where to go? This looks like Greenville. I know people driving Greenville. So it's like, it's like what? Good luck. And so when patients here, what's that?
You're just supposed to stop.
Stop, just stop.
Ignore
Get out.
all the other side.
Stop and back up.
Don't go left and don't go right.
So that's what patients may be thinking. They're like, what do I do now? If they're newly diagnosed, or maybe they're a treatment challenge or change, and they're confused. And a big issue with patients is health literacy. Millions of patients in the U.S. have diabetes, and about 88%, I'm skipping over, 88% of adults have some form of health literacy deficiency, where they're not able to obtain, process, understand basic health information that they need to make good decisions about their health care. A lot of patients with these deficiencies have limited abilities to perform basic math skills, read and write, and it really hits you when you come in contact with a patient like that. I've had people, just a simple example, where they get their weight in kilograms and they want to know how many pounds, and they've got their cell phone. I say, okay, just multiply it on your cell phone, get your calculator out and do 2 by 2.2, and they just go, can you do that for me? And it really hits you like, man, we really need to sit down and talk with them. So here's some tips. Maintain eye contact. And a lot of times we're focused on the computer, getting our chart done, and we're not even looking at the patient. We need to make sure we sit down with them and make eye contact. And return explanation. If we tell them, I need you to take your metformin twice a day. Okay, I need you to take it in the morning and at night, and then have them explain that to you, what they heard. Return demonstration, like with insulin, you draw it up, and then you have them show me how to draw it up. You can incorporate pictures, large print, like for the morning you have the sun, and you may have heard this before, for the evening have like a moon. Discharge begins on admission, and you continually work through it during the hospital stay, and it can be changed. And again, it's patient-centered and their caregivers. Follow-up provider, you can schedule an appointment. It helps to prevent readmissions and ER visits if you have already scheduled that follow-up appointment for them. Educate patient on how, when to take their medication, signs and symptoms of hyper or hypoglycemia, so they'll know when to call their provider. Healthy diet choices. and the beach. That's where, that would make me feel better. But now you each have a type 2 diabetes. Are you at risk for, and you don't have to answer, just pick a partner, do it all together as a group. It just gives you an idea. And maybe you have a patient that doesn't have diabetes, but they have questions about it. And if they're at risk, or you have friends and family, then you can just go through and if you score a 5 or higher, then you're at risk. And it also gives you the age, what age is a risk factor, not being physically active, and you can go through that. And if you want to, you can make it up, but just take a few minutes to. You can take it home and do it with your significant other, or say, I told you need to call the doctor. And then the next form is just the diabetic teaching plan assessment questions. You can go through and see if you learned something. Hopefully you did, or reviewed something.